Let's start with the topic. Today I'll be taking the topic of tibial nerve. So if we go by the line diagram of tibial nerve, first let me draw the line diagram. Then one by one I'll be describing which muscles it supplies and what are its relations throughout its course, right? So as it starts from the root value, as you can see here, L4, L5, S1, S2 and S3, lumbar 4 and 5 and sacral S1, S2 and S3. So as it starts here, it goes on to supply the gastrocnemius muscle first, then it goes on to supply the plantaris. Then as it comes down on its way, it supplies the lateral head of gastrocnemius. Then it supplies all the muscles of the knee joint along with few of the meniscus, right? Then it turns around, it sort of takes a U-turn and supplies the popliteus also. Then from the popliteus nerve, there is a subdivision which is superficial tibiofibular joint. It supplies even that. Then it comes down, further it comes down. Then one of the major division which branches into sural nerve, right? This division is very important because it comes just after the popliteal fossa, right? Popliteal fossa is back of the knee. Then as you cross it, you cross the popliteal artery. After crossing the popliteal artery, it supplies the soleus. Then it supplies the FDL, tibial is posterior and FHL, right? Then as it comes down, now it goes on to supply the foot. On the foot, it supplies the first lumbrical, then adductor pollicis, which is the great toe, then FDB, flexor digitorum brevis, and flexor hallucis brevis, right? Then it goes on to supply the skin of the sole, right? And one of the most major branches here is it again supplies just after, when it enters the sole of foot, just after the division of leg, it supplies flexor digitorum accessorius. Then it goes on to supply the skin of sole of foot. Then it supplies the adductor digiti minimi. Then it goes down again, it supplies flexor digiti minimi brevis. Then all of the other lumbricals which were not supplied here, such as second, third and the fourth lumbrical. Then it goes on to supply interossei. What is the interossei? Interossei is the space between the lumbricals, right? Then it again supplies the adductor hallucis. This is the course throughout how the tibial nerve travels, right? Then how briefly, if we have to describe the course, how does it go? Is it goes along the popliteal fossa, then it goes through leg, then it goes through the sole of foot. Then now we'll be talking about some clinical features about tibial nerve injury. First, if there is tibial nerve injury, there will be motor loss. What is motor loss? Conscious movements will be lost, like foot dorsiflexion or inversion. Dorsiflexion is the foot is like this. If you move it like this, it is dorsiflexion, and inversion is the total inversion, right? Then loss of prominence of tendocalcaneus. Then loss of plantar flexion. Now there is sensory loss also. Loss of sensation of sole and plantar flexion. All such signs as tickling the foot and all those will not be caused. Then tarsal tunnel syndrome is caused, which is due to the compression of tibial nerve under flexor retinaculum of ankle. Flexor retinaculum of ankle, in the sense the supply goes off from here, right? And from this point the supply gets cut off, right? Then there is Morton's metatarsalgia, due to which formation of neuroma is caused on one of the plantar digital nerves. Plantar digital nerves, in the sense these in the lumbricals or these, right? Thank you.